Hey guys, I just wanted to update you on something that is specific to the interns. When you go into the emergency medicine Schoology page, you'll see a folder that looks something like this. It'll say vascular access, and for interns, when you click on that, you're going to see a few links here. One is the ultrasound guided IV lecture that most, if not all of you, saw prior to doing the ultrasound orientation, and then you'll have these 3 lectures here. These are actually the lectures that we recorded live on the day of the ultrasound orientation. I know we were doing the ultrasound guided IV training, and you may have interrupted some of your lectures, so this is here for you if you want to go back and catch anything that you missed, or if you just want to hear anything again, it's all there for you. Now, something that is new this year, because we're taking a closer look at ultrasound guided IV performance in our interns, as well as our medical students. What I need for you to do, if you are an intern and you're getting one of and you're putting in a peripheral IV, this doesn't apply to arterial lines, it doesn't apply to central line, it's just peripheral IVs. Get this form and print it out for every IV that you do in the emergency department. I don't think it's realistic to expect you to do this outside of the emergency department, because I don't know what kind of supervision and availability you have and all that stuff. But in the ED, it's really easy to have a nurse who's maybe done this for a long time, or one of the faculty members, or a senior resident fill this out for you. So when you're putting in peripheral IVs, I want you to print this form off and have somebody supervise you this year while you're putting in these peripheral IVs. As you can see the form here, I just need your name, the date, whether you did the live or web-based instruction, and also the person who's going to supervise you will click off yes or no on all these things, basically gauging your performance. We'll have the supervisor put their name here, the number of attempts that you had putting in the IV, and that's needle coming out of the skin and going back in the skin, not necessarily redirecting the needle or anything like that. And ultimately, were you successful? Now, obviously, the supervisor can stop your attempt at any time if they think that you're going to hit a nerve or an artery. Again, print one of these off and have the supervisor fill it out for you. When you're done, you then go to the vascular access grading form depot is what we've called it, and you're going to upload the form here. Now, the way you can upload the form is actually click on the depot here, and then you're going to select add media. Now, this is important. The format that this will accept will have to be actually a media format. So I think probably JPEG or PNGs is going to be the easiest for you to use. It's not going to accept PDF. It won't accept Word or Excel or anything like that. So I think the best way to do this is, after you get the form filled out, just take a picture with your cell phone, pitch that onto your computer, and then you can upload it. So here is what it's going to look like. You select to attach a file. Here is a PNG of a form that I did. I'm going to select that. Once it finishes uploading, you just select add media. And there is your form that has appeared there. Now, you'll see that there's really no caption there. So you're going to select add caption, or you saw that it actually just disappeared there. If that happens to you, you can go in here and select edit caption, and then just put your name, save. Then when you go back to the depot, you'll see that it appears here with your name on it. So that'll make them easy to sort. And obviously, with 13 of you putting in peripheral IVs, this is going to get quite a lot of forms in there. So it's important for you to make sure that you put your name on there so we can easily find that. Now, listen, I know that you're busy. You're trying to see patients, trying to do your documentation, you're trying to log your procedures. The emergency department gets very busy. I understand all of that. I think there's a couple of ways that you can do this without disrupting your flow or efficiency. What I recommend you do is, at the start of your emergency medicine month, print off a whole stack of these and keep them in your bag. When you have a IV to place, grab this form, give it out of your bag without having to log in and print or anything like that. Grab it out of your bag, and you can give it to your supervisor and have them fill that out. And when you finish getting the form filled out, just take a picture with your phone and save it on your phone. And then in between shifts, or whenever you have a little bit of free time, you can pitch those pictures from your phone over to your computer, then log into Schoology and get those uploaded. And then that way, like I said, you're not having to do this on shift while you're juggling a whole bunch of other tasks.